this patient who comes from Yemen is a young man and he suffered from a gunshot injury on his ankle.
بسم الله الرحمن الرحيم. حصل يوم 15/4 مشكلة بين ولد وخاله وأنا كنت معهم، والمشكلة هذه ثار قبلي وقاموا بالعداء علي محاولة اغتيال أو قتل من هذا النوع، وما دار إلا أن دافعت على نفسي، وأنا قمت بإطلاق نار في الجو الغرض أني أفرع عن نفسي أو دافع عن نفسي وسلامتكم. والحمد لله اسعفوني على طول على عدن منظمة أطباء بلا حدود.
They did whatever they can in Yemen in that hospital. They cleaned out primarily, but they were not able to complete the job because it was very difficult surgery. So they were able to do a minimal cleaning, and they had put some stabilization in terms of some rods outside the body. And this gunshot injury was so severe that he has lost muscle, he had lost skin, he has also lost the bone in that area, leaving him with about 6 to 8 inches of bone loss in that area, which was lost probably at the site of the gun injury. Second issue is because all this foreign body from the gun, like gun pellets, gun powder, etc., were lodged in the body.
وتم تلقي العلاج هناك لمدة شهر أو شهر ونص، وإلقاء 4 عمليات، لين تمت الإجراءات والسفر من السفارة الهندية. صراحة في اليمن ما أعطونا أي أمل، وعندما وصلنا الهند ورحنا المستشفيات الثانية قررت اتحطمت حتى أني وصلت أني سأبتر رجلي، ورجع الدكتور عبد الناصر الشيبة وشرع علينا مستشفى فورتيز.
It was over 6 months when they trying to ship him out of the country to a facility where all these things can be done. In the meantime, I had operated on another patient who was in Bangalore as a student. So because of the contact from that student, they referred this patient to me from Yemen. When I saw him, he had a big wound in the lower part of the leg. Pus was pouring out. There were some external rods which were applied on the leg for the stability of the leg temporarily. We did an X-ray, we did a scan of his leg to see the situation.
أول دكتور قابله بهذه الطريقة يشرح لي شرح تفصيلي وبالرسم على البيبر، يعني من بداية الدكاترة لم يشرح لي أحد نفس هذا الدكتور، يعني أعطاني أمل كثير بالله سبحانه وتعالى نتعافى وأني أمشي عليها.
So we took him for the operation, and first thing we did was we cleaned his leg using all our specialized equipments. There were a lot of dirt and a lot of bullet and a lot of gunpowder inside the bone and inside the body, and we had to clean all of them. And the second biggest, the largest problem was the infection in that area. We had to clear that as well. Once we have done all this scavenging cleaning job, then we had to reconstruct his leg, which was difficult because we are not having any bone in that area, and we can't get that kind of bone by using metal or any other artificial substitute because he is so young. So what we did was we took one of the bone from his own body called fibula, which is an extra bone which is not used for most of the normal activities. We took about 8 inches of that bone out, we cleaned it, and we have fused that bone to his own remaining bone of the leg, and we have stabilized with our advanced reconstruction system on the leg. Now because of this bone graft, he is going to have a scaffolding in his leg because the original bone is not there, and we have put a new bone in that area. And over a period of time, we have also added some more bone graft from his pelvic area, where there is again redundant bone. Because of that, bone which we have transferred from the original site to the wound will grow over a period of time by about 3 months or so. After 3 months, probably we will be able to remove the external stabilization system which you have used, and also he may be able to walk on his leg. This was one of the very rare case in terms of injury and in terms of complications of the injury and the treatment, and also the reconstruction method what we have used. Recovery is usually 3 to 6 months for these kind of problems, because the bone has to grow inside. Even though mechanically we put everything, his body has to heal all of them. Once everything is healed, we are hoping that he will be able to do almost all his normal activities. He may not be able to do the sports or anything higher, but we are glad that we may be able to make him at least walk and mobilize for all his normal activities, and if possible for work also throughout the life.
ثاني شيء عندما أروح البلاد كأي مواطن يعني أرجع بلدها أكيد بيكون سعيد جدا، وإن شاء الله الله أعلم إيش القادم. إن شاء الله أننا نستقر في الحياة الزوجية.